We appreciate every visit we get from those professionals who are on the front lines and dealing with the information that we rely on as far as COVID-19 and testing is concerned for this virus pandemic. And Associate Chief Medical Director Mark Wakefield has been with us a few times before, and he joins us again. It's been a while. Welcome, Doctor. How are you today?
I'm doing well, thank you. Good morning.
Let's talk about a couple of things in regard to testing. Since we last talked, the University of Missouri Healthcare opened a second testing, a drive-through testing spot. How has that helped? What can you tell us about what's going on at Mizzou North?
So we opened up Mizzou North about 2 weeks ago in response to increased demand for testing. There was a date where we had more than 600 tests done through the drive-thru, and that created our longest lines. At Hearns, the lines were quite long. Patients were waiting 4 hours in their car. So we had a contingency plan to open up a second drive-thru if needed since mid-March. And, of course, we anticipated that we would need it back then, and fortunately we didn't. Social isolation helped us bend the curve, but we've had increased number of people seeking tests, and for multiple reasons, and we decided to deploy that second location to facilitate less wait time for patients needing a test.
I've talked about this before on this program. Anecdotally, I pass through on my exercise several times a week, and I can go within visual scene of what's happening at the testing site near the softball field and the Hearn Center at the MU campus. And again, 2 weeks ago, unbelievable lines. Those lines are back to what they were a few weeks ago. Is there a reason why there were so many people being tested for that one stretch of time?
Well, I think for certain we're doing more testing of asymptomatic patients in preparation for surgical procedures. Now we have other locations where asymptomatic patients can be tested, but we also had an increased number of diagnoses in Boone County and the surrounding area, and many of those patients had close contacts with other patients. So we tested a lot more asymptomatic patients who had contacts. Mm-hmm. And so that put a big strain, and you can envision if one person found out they were positive and then went to a social gathering, and then there were 20 people there. Many of those 20 people would want to get tested, and even if they didn't have symptoms, because they want to know their personal risk and whether they're going to be at risk for impacting their family. And if they contacted a few people, pretty soon you've got hundreds of people that are seeking testing.
And as far as getting testing is concerned, clarify for us again. I was looking at, I mentioned a article that was posted late yesterday afternoon in the Tribune, and will show up probably in the print edition today. And it says testing is not so easy to obtain in Boone County for the average citizen. A physician's order is still required to be tested for COVID-19. I didn't think that was completely accurate. What is your reaction to that?
Well, we've, in general, always required a provider's order to get testing, and we've done everything we can to make that easy. So it's not really any different than any other laboratory test where deciding the appropriateness of testing requires some degree of medical knowledge. And then we can facilitate that testing through virtual visits or telehealth visits or phone calls to a provider's office. And why this is particularly important is we were just talking about the asymptomatic person who had a significant exposure risk. We've recently learned that the ideal time for testing is 7 to 9 days after the exposure. So if patients are driving themselves without guidance from a provider, they may go and get tested on day 3, but that's too soon, and they'll have to be retested again before being cleared of risk of being infected and or infecting someone else with another another test after another 3 to 4 days. That's 7 to 9 days afterwards. So and testing supplies are constrained. We're able to do more than 500 tests a day. That's been the demand over the last week, with some variation. But it's not an endless supply of swabs or reagents to do the test. So we have to be a little bit careful and wise about the timing of testing and the indications for testing.
And how long does it take to get the results back on average?
So right now we're getting test results back if they're positive with notification to the patient within 24 to 48 hours, and if they're negative, the notification is happening at 72 hours. Now, again, this varies based on the number of tests done on a day, and we have staff that we can flex, but it's not an infinite number of staff to do the kind of the work of running the laboratory test and calling patients. But I got tests back within 24 hours for some of my pre-op patients yesterday. So the lab and the communication teams are doing a good job. But, that big influx of patients you talked about on your bike ride definitely put strain on the system.
So then let me ask, if you don't get contacted, though, within 24 to 48 hours with a positive result, you can pretty much assume that you did not test positive then.
Well, I don't think you can assume anything because we've had stories of incorrect phone numbers and contact difficulties. Plus, we're partnering with the health department for contact tracing, and really, if you're the most important thing to do rather than getting tested, if you're exposed, is you have to have the self-discipline to isolate and quarantine yourself until you know the results of that test, and even then, a negative test, you're going to be close to 10 days of quarantine if you've been exposed. So that really that goes back to the most important thing is don't put yourself in a situation where you're going to be exposed, right? Which means avoiding large crowds in indoor spaces, wearing a mask, and then protecting yourself by washing your hands.
I'll find out I'm exposed then generally by contact from the health department saying that we are doing contact tracing and you were next to somebody for a certain amount of time in a certain situation that would have exposed you to COVID-19. Is that how it's generally done?
Yes, there's three ways in my mind that you would learn that you were exposed. The person who becomes positive calls you or lets you know, and that's perhaps the most common. They got a test and they know that you had a close contact. The second is by contact tracing from the health department, and the third is they're suffering from strain on their system as well. And if a location is very crowded and difficult to contact trace, there'll be an announcement that a particular location or event had patients or citizens who became patients with COVID-positive testing. And so then there's a public announcement. So those, in my mind, are the three ways that you're likely to learn from a patient themselves, from the health department, or from the media.
Yeah, I understand that. That's good. I really appreciate that. That makes it very much clear. I hadn't heard it quite that clear before. And then let me ask you this. As far as the University of Missouri, they've held a couple of meetings over the last couple of days remotely with staff and faculty, and then also with families and students who are anticipating coming to the University of Missouri. And help us understand, when we read those accounts of those meetings, when it said that students will not necessarily have to tell or could tell that they had tested positive. How do you as a medical professional help those of us who are not understand the importance of that or the lack of emergency feeling that we get when it's like we won't know, but we can't know because of the protection of some information?
Right. I think it comes down to privacy protection and encouraging disclosure, which is not any different than off of campus. Individual citizens should disclose, but don't always. The other thing I feel about now this is personal opinion, but we're learning so rapidly, learning from some scientific but some social knowledge about what is expected and what is tolerable, and which for many of us, we have to be able to change what we perceive to be the best thing rapidly. And I think over the next month that we will likely see an evolution of what our guidance is as students return to Columbia and as other activities such as public schools or athletics, as was mentioned in the break, this is a lot of uncertainty about what degree of opening up is safe and what the best timing is.
Before I let you go, two quick things. Any numbers that attract your attention right now when we look at the Boone County Information Hub? Active cases, 199. That's as low as it's been since back on July the 8th. But the number of contacts quarantined is still high at 561. And hospitalizations currently in the county, and this is not all Boone County residents, at 21, 7 in the ICU. I know early this morning, 17 in MU hospital and clinics. Any numbers or trends that are particularly catching your attention here recently?
So I think there's day-to-day variability on the number of positive tests related to not only the number of people getting tested, so generally on Sundays, none of the drive-thrus are open presently, and there's not as many tests being done, but also the rate at which the tests are getting done. So there's some normal variation, but we've been pretty steady for a couple of weeks with 20 to 30 positive tests per day. Many of those are not necessarily very significantly symptomatic, which is what we would expect because we haven't had that many admissions. Though one of the challenges for the ICU team is that a patient admitted to the intensive care unit, especially if their breathing deteriorates, and they get ventilated, they're often here for a long time. So most people will recover, and they'll be better in 10 to 14 days. We've had some patients who've had lingering symptoms for a little bit longer. But if you get the severe manifestations of the disease, people can be very sick and in the ICU for a long time. So I anticipate that we'll have, for the next few weeks, and this is just a guess, similar numbers of positive tests as there's community spread, with similar numbers of admissions, though the admissions usually follow 7 to 10 days after a positive test. So we're still at risk for more people being admitted, and many of them will stay in the hospital for a long time.
Dr. Wakefield, always appreciate your time. I know that you are in demand and have your own practice and own work to do. So thank you so much for the minutes that you've given us.
It's my pleasure always. And just to remember that, what I've observed, if you don't mind me editorializing a little bit, we're not, when I first started helping people try to understand COVID from the view of a non-expert, and I consider myself a non-expert, I'm not infectious disease, but washing hands remains one of the most important things we can do. And, there's a lot of debate about whether the virus is in the air, but the most common way that we spread is we bring it to our mouth with our hands. And that's a hard habit to break, and we were hyper-vigilant in March. And I just know myself and others have regressed into our normal behavior of using germ gel but not washing our hands for 20 seconds. So I'm just going to remind people to wash hands and avoid crowds if they can, and mask when they can't avoid people. So
I'm glad you made that, because it is a reminder we need to hear. It just so happens an hour from now I'm going to be interviewing another doctor. He writes for The Atlantic. His name is James Hamblin, and he's just put out a book that's called Clean, and it's about cleanliness, and he also stresses the importance of washing hands. So I'm glad we got that in there again from you today, too. So thank you so much. Good to talk to you.
Okay, thank you for your time. You bet.
Dr. Mark Wakefield, Associate Chief Medical Director at the University of Missouri Hospitals and Clinics. News in 15 seconds.